So first off, who is Lifesharing? So we are an organ procurement organization based here in San Diego. We serve San Diego and Imperial counties, which covers 28 hospitals and 4 transplant centers. Those transplant centers, one being UCSD, but the other 3 are Rady's Children's, Scripps, and then also Sharp. We are a not-for-profit organization, and we are regulated by CMS, OPTN, AOPO, and UNOS. We also have an FDA and AATB accredited tissue bank. And along with our life-saving transplants that we do every day, we also provide professional and community education. So first things first, our priority and our mission ultimately is to honor the wishes of donors and their families. We educate and collaborate with healthcare providers and the public. We also represent and support donor families and recipients who are wishing to donate their organs or tissue, and then the recipients who are on that wait list. And then again, our goal is to inspire others to register to be donors. April is a big month for us. It is National Donate Life Month. So more than 100,000 people are waiting for a transplant, and that's what we do. Transplants rely on the generosity of organ, eye, and tissue donors. So in April every year, National Donate Life Month is really to raise awareness about donation and encourage everyone to become a registered organ, eye, and tissue donor in order to save some people through the gift of donation each and every day and to decrease that wait list as much as possible. Just to give you a little bit of perspective, there are more than 108,000 people on the US organ waiting list because California is so heavily populated. 1 in 5 of those on the wait list are actually residing in California. And again, just for perspective purposes, 108, that is more than Petco Park and Snapdragon Stadium filled to their capacity. More than those stadiums combined is the amount of people on that wait list. So you can see there are thousands and thousands and thousands of people waiting on a life-saving transplant. Why the need? So every 10 minutes, a person is added to the national transplant waiting list. And unfortunately, over 8,000 deaths occur because organs are not donated in time. In fact, 22 die each day because of that, unfortunately. California makes up the largest part of the wait list. Like I said, 1 in 5 individuals who are waiting for a life-saving transplant reside in California. In addition to that, that means those patients have the longest wait times and the most deaths while waiting. Majority of transplants needed is kidneys. You can see 82% of those people that make up the wait list are in need of a kidney. And a misconception of organ donation is we can only donate if you're young or in really great health, and part of that is true, but shockingly 1 out of 3 deceased donors there are over the age of 50. So every day organs are being donated from those who are 60, 70 years old, even 80. A single donor can have so much impact. One single person can save 8 people through organ donation. They can restore sight in 2 people through cornea donation and heal over 75 lives through tissue donation. Just breaking down the type of donation, particularly what the department that we work in is eye, tissue, and organ donation, but also there is whole body donation and living donation. So living people can donate their kidneys or part of their liver or a lung. So breaking down tissue donation to begin, who can be a tissue donor? So anyone who has died inside or outside of the hospital can be considered for tissue donation. It is very similar to the requirements as those who donate blood. Tissue donation coordinators work really closely with the hospitals, medical examiners, funeral directors, coroners throughout the referral and evaluation process. And again, these donors save and enhance lives of more than 1 million people in the US each year. One donor can enhance the lives of over 75 people through tissue donation. Here are the types of tissue donation that take place. Heart valves, a lot of heart valve donation and transplants are for our little ones. A lot of little ones will get in the pediatric hospitals will be transplanted with heart valves if needed. Skin for grafts for burn victims, breast reconstruction. It promotes healing, reduces scarring, and restores the abdominal wall. blood vessels, connective tissue, bone for reconstruction related to trauma, tumors, disease, and then again, eye donation to replace diseased or damaged corneas, reinforce the wall of the eye and restore vision and prevent blindness in those who are facing that. Organ donation. So who can be an organ donor? It's a little bit more difficult to become an organ donor because you must be ventilated in a hospital. There are a couple different pathways to organ donation that we will touch on a little bit later, and that is a brain dead donor and a donor after circulatory death, which we often describe as a DCD donor. And part of my job in our organization, Lifesharing, is to determine if a patient in the hospital on that ventilator is medically appropriate for organ donation. Types of organ donation: lungs for conditions such as cystic fibrosis, pulmonary hypertension, emphysema; a liver transplant, pancreas, heart, kidneys, intestines. And again, just to reiterate, a donor can save the lives of up to 8 people. Each lung can go to 2 different recipients, and a liver can be split to 2 different recipients, as well as the 2 kidneys. So that's where we get the total of eight people to be saved potentially from one donor. So how does organ donation happen? So it initially starts with a referral call. And what that looks like is hospital policy, CMS and TJC, they require all hospitals to call all deaths into Lifesharing. So whenever someone is admitted to the hospital and they pass away, they're required to call Lifesharing. And at that point, we are notified by all those cardiac deaths, and that's when tissue donation is considered. And we are called when there is a ventilated patient who may meet certain criteria for Lifesharing. Once we get that call and that patient is kind of on our radar, then Lifesharing will gather a little bit more information. We will go on site to the hospital. We will do a more thorough assessment of that patient. We will speak with the bedside nurse, and that is when we determine if that patient is a candidate for donation. Once it becomes appropriate due to Lifesharing's more further assessment, depending on how the family is doing, how the patient is doing clinically, that is when Lifesharing will determine if the option of donation it is available, and we will speak with the family and also consider the patient's registry status at that point. Like I briefly touched on, there are a couple different pathways of donation. We have our DCD donor, and then we have a brain dead donor. So with the DCD donor, this is when a family begins discussing transitioning to comfort care. That's when Lifesharing becomes involved. The hospital is responsible for the medical management of that patient. However, we just work very closely with our hospital partners in order to do all of our testing and the required needs in order to find recipients and for that patient, for that donor to save as many lives as possible for the recipients on that wait list. We will, the family will withdraw care as planned. And then if the patient passes within that certain time frame, then we will move very swiftly to the OR, and that's when the surgery will take place for the organ donation. The other pathway is our brain dead route, and that's when there has been confirmatory testing done where a patient is clinically declared brain dead by law by 2 separate physicians. And these physicians are physicians within the hospital. They have no part with Lifesharing. They follow the California state law and hospital policy in regards to the declaration. We will speak with the family, take account the patient's registry status, and begin our process of that medical workup. And Lifesharing is able to actually assume the medical management and do all the testing needed in order to determine what organs can be transplanted. And then we will go to surgery, somewhat similar to the DCD pathway. It's just a little bit more controlled. Ultimately, our guiding principles, first and foremost, is to recognize that these families are losing their loved one. That is our primary focus. It is not donation. We truly believe here at Lifesharing that when a family is supportive of donation and they decide to move forward, whether or not any organs are actually transplanted and received by a recipient, they're a hero in our eyes regardless. We try to see it from the perspective as we're not taking something from the families, we are giving something to the families and allowing them to have their loved one save someone else through the opportunity of donation. a couple things that we do to honor our donors is we really do a lot of personal mementos with our donors and for the donor families, and this includes lockets of hair. We have a really beautiful butterfly donor blanket that we put on our donors in the hospitals, and that way when nurses and doctors and visitors walk by, they can see that blanket and recognize that that patient is working up to be an organ donor. The hospitals, we work very closely with hospitals, and a lot of hospitals will do honor walks. And this is when a donor is going to the OR. A lot of times staff members will line the hallways to just have a brief moment of silence and recognize this donor for saving lives and also this donor family's loss. We do a donor medallion, which you can see a picture of it here, gift of life donor. We do handprints. UCSD has a donate life flag that whenever we have a donor, it is raised for 48 hours. So whenever you're outside UCSD, Hillcrest or La Jolla, you see that donate life flag, you know that there was a donor within the hospital within the past 48 hours. And then finally, we do offer continued support. Once that patient goes to OR, the support does not stop there. We have about a 2-year aftercare program where we're able to facilitate follow-up phone calls, letters. Our donor families can be volunteers. They can take part of a day of remembrance, which actually we're getting ready to celebrate here in a couple weeks, and then many other special events and activities. If the recipient and the donor is open to it, we also can help facilitate families meeting and again, writing those letters and having that communication with each other. Donor registry. So this is when a person decides to first person register themselves, such as at the DMV. And this is a legally binding decision where someone decides to be an organ and tissue donor. Additional witnesses or consent is not required. And this is when we have a patient in the hospital and we're speaking to a family that is what we like to inform them of, that, hey, your loved one, they decided to make the selfless decision to be an organ donor, and we'd like to talk to you about these next steps and what that looks like. Lifesharing is responsible for checking to see if a patient is a registered donor. And again, like I said, when the time is right, we'll have that patient kind of on our radar, but when we deem it's appropriate and the family is in an okay spot, we will speak to them regarding those next steps and present them with that document of gift. And then finally, along with the registry, just some information for all of you guys. If you're not registered to be a donor, again, along with April being Donate Life Month, here's how you can register. So you can register in the National Donate Life Register at registerme.org. Or actually, you can do it if you have an iPhone, you can do it in your health app. If you are already registered, you are able to log into your registry and you can look into other opportunities. You can specify any donation preferences. One thing that I learned when I started working for Lifesharing is you can actually go in, you can take a look at what tissues you're opting in to donate, what organs, you can update your donor profile, add additional information in there. You can look up more information regarding research, and you can also print your document of gift if you want to keep a hard copy for yourself to add with any other end-of-life documents. I think that wraps up my portion. Thank you guys so much. I'm happy to take questions now, or I can wait until the end. So thank you.
I have a question. Do you have to be a donor? Do you have to be in perfect health, or are you also is there any criteria of medical conditions that would make someone's organs ineligible?
Yeah, actually, that's a really great question. And the answer is no. There is no really hard, well, I would say typically the biggest reason a patient cannot donate is if they have active metastatic cancer. So that is one where typically organ donation we're not able to pursue organ donation. However, any other medical condition that you can think of, hepatitis A, B, C, any drug use, hypertension, all of the normal health conditions that you see as you age, none of those are a hard rule out for us. Each donor is viewed on a case-by-case basis. So when we are gathering that information, we are looking at labs, we are looking at any imaging that has been done in the hospital, and we are taking a look at that medical and social history to see what kind of behaviors that patient took part in. So the only, I would say, hard rule out is if a patient has active metastatic cancer, but other than that, it is all case by case basis. And we see a multitude of health conditions, and those people are able to still save lives each and every day.
Yeah, I think maybe that's why individuals maybe over 50 or whatever probably think that they're not good candidates and maybe, don't check that off on their driver's license or something.
Yeah.
Wish
Yeah.
the message could be better communicated. So thank you. That was very helpful. Yeah,
Of
metastatic
course.
cancer and not to rule out other things then.
Yeah, of course. I totally agree. And it is crazy whenever we speak with families. I would say most of the families I speak to, and if they will be supportive of donation, they'll be like, but you don't want any of their organs. And it's just a very common misconception. And they can have the most colorful history and they can be in not the greatest of health, but they are often in better, their organ function is better than someone who is on that wait list and has limited days left to live because of their current organ function.
Okay, thank you.
Yeah, of course. Any other questions?
Kirsten, I see a question in the chat. Sorry.
Oh, yeah. No, go ahead.
Oh, Tom, go ahead.
Oh, that was my question in the chat. I've donated my body to the School of Medicine, but I've also registered as an organ donor. How does that integrate, or is there? I mean, I guess I was wondering how that works.
Yeah, that is a great question. And I will say I'm not an expert when it comes to whole body donation. I will say that if it were to come to you are in the position to donate either your organs or your tissue, I believe, and I can fact check this and have a for sure answer to you by the end of this presentation. I believe that the organ and tissue donation would take place first, and then we would help facilitate the whole body donation after. I will say that if you are donating your organs and your tissue, I'm not sure if that changes the criteria of those research facilities who are accepting of the whole body. If that makes sense. And I don't know, Amanda, do you know any information about that?
Yeah, so backstory, I used to work with Lifesharing, so I have a little bit of background here, but whole body donation through University of through UCSD, they work very closely with Lifesharing. And so it does not negate you being able to donate your whole body if you also donate organs and tissues. There's a liaison for the whole body donation program who will work with the Lifesharing coordinator, and they'll make sure that they're both taking care of what they need to on each of their ends so that you can do both if that's your wish.
Okay, great. Thank you very much.
Of course.
Thank you, Amanda.
Of course, Kirsten. Any other questions for Kirsten or Kylie? Thank you both so much.
Of course. Thanks, guys, again for the opportunity. If you have any other questions, I'll be on a little bit longer, so feel free.
Great. I think we'll have give a little more time at the end just in case anyone comes up with questions, or you can put them in the chat if you want to remember them. And I will share screen now. I'm going to bump your screen sharing, Kirsten. So thanks again so much for inviting all of us to speak to your group and do a spotlight on organ donation as well as the transplant programs at UCSD. My name is Amanda Cole. I'm the clinical nurse manager for the lung transplant program here. So I'm going to give you an overview of the Center for Transplantation at UCSD, a little bit about our team, our programs, our growth, give you some patient stories, and also go over some of our rankings. So here we go. All right, the first thing I want to share with you today is a reflection. We like to start a lot of our meetings in transplant with reflections, and this is one from a lung transplant patient who wrote this poem about his experience with our team and our program. So I'll just read it out loud. I really liked this one. This is from Daniel. With love and appreciation to the team of doctors and nurses, angels in white at UCSD Health. Thanks for the personal, devoted, warm attitude. Thanks. I want to tell everyone for the treatment with love and a lot of patience, an exemplary team of real art. Your work is sacred, performed with piety, to give a person a life with quality, not by grace, but by virtue. It's a different league, a championship title. All of these and more, I want you to sing, to write you poetry, wrapped in a lot of warmth and atmosphere, the smell of citrus perfumes the air. You gave me the strength to stand up, dance, sing, green fields in decorative colors. Thanks to you, I came back to life. Sun is shining, butterflies are flying, the calm sea, seagulls above, wreath of congratulations, best wishes attached. May we be blessed with your number in the hundreds and thousands. And I like this for a lot of reasons. You know, we just heard about donation and, you know, that someone gives their life in most circumstances to give life to someone else. And the symbol that Lifesharing uses a lot is the butterfly. And I don't know if this patient knew that, but I just love that he referenced that. And, you know, this is someone who's writing poetry because of a donor from Lifesharing or one of the other organ groups around the country. So at UCSD, we have 4 solid organ transplant programs. So different hospitals will have different organ transplant specialties. We are the only organization in San Diego County that does all 4. And we're also the only lung transplant center. So we transplant hearts, lungs, livers, and kidneys. We also do multi-organ transplants. That means someone may need a liver and a kidney. Someone may need a heart and a lung together. Or there's even more complex combinations. For example, a heart, liver, and a kidney transplant. And we do all of those things here. So you must wonder our size of our program, and I wanted to share this with you because it really emphasizes what a multidisciplinary team we are here. We have over 227 providers and staff members across the Center for Transplantation. We have a very large heart transplant and VAD program. A VAD is a mechanical assist heart. It's called a ventricular assist device, and it's an implanted mechanical heart that tends to go in hand with transplant or a bridge between both. We have a very large lung transplant program, a very big liver and kidney program. We have a lot of supporting teams in transplant as well. So we have an allocation team, which is over 20 staff members that are responsible for taking the calls from Lifesharing. So Lifesharing works on the donor side, and when they are at a point that they're offering the organs out based on the list, this is our team on the recipient side that answers those calls and then helps make sure that we're matching the best recipient and the best donor, and then works on setting up the transplant on our side. We have a clinic as well where we see all these patients before and after transplant, make sure they're healthy and doing great. We have a float team that helps us cover absences, a quality team that helps with all of our data and regulatory requirements. We have an infectious disease team who manages our patients. We have a team that answers our phones, and they tend to answer about 2,000 phone calls a month. So very heavy call volume coming in for us. We have I'm sorry, that third slide, a third row on the bottom is actually living donation. So we have 3 nurses, 2 admin assistants, and 1 social worker on living donation team. And then we have an infectious disease team, a pharmacy team, and an operations team. So it's a giant team that we have all working together on their individual organs and working together to give life from the gift that Lifesharing is working with. This is a little bit about our volumes. So we've had a pretty big growth in the last 5 years across all of our programs. In the last 5 years, we've done over 1,500 transplants at UCSD, many single transplants, but many combined transplants as well. You can see the heart program is steadily growing. I'm probably expected to hit near 100 this year. The lung team is growing a little, but COVID definitely had an impact on lung transplants in general. And then the liver program is set to probably be at 100 this year. We had a little dip last year, but they've already done 40 transplants so far since January. And then the kidney program is also set to have a record year this year. So I think the best way to talk about transplant is to talk about the stories. I know Kirsten and Kylie could share probably 100 stories about the donors they work with, but I love talking about our patients and that the life that they get to live after transplant. This is Francis, he goes by. Francis is an interesting story. This was just put on UCSD's webpage a couple of days ago. in honor of Donating Life Month. I'll paraphrase this all for you. You're welcome to go back and read the story. We can share the slides if you want to read the link. But he had a congenital heart issue. He was diagnosed with pulmonary hypertension. He was in the Philippines when he got sick, flew back and was admitted straight to the hospital. We have a really great congenital team and pulmonary hypertension team at UCSD that work very closely with the heart transplant team. And he actually was managed well for 7 years with those two teams managing his health. He did pretty good for those 7 years, and they were able to give him 7 more years before he needed a transplant. But his disease state caught up with him, and he had to be listed for a transplant. And that was in 2020. He was on the transplant list for 6 weeks and transplanted on August 8th. And now he gets to see his son grow up. He has a 3-year-old son and a wife, and they are just so happy. He says, "I'm alive because of my organ donor and the doctors and everyone else who touched my life throughout the entire process. It was so worth it." And he received a heart and a lung transplant. He was a dual organ. This is one of our lung transplant patients. The link is at the bottom if you want to go hear him sing. He's a pretty famous country singer, and he needed a lung transplant, and he received one with us. And it's wonderful because he shares his open mic and different touring videos with us right now. And I don't know, there's something just really special about, when you get your lungs transplanted, they also transplant a portion of your trachea. And so to be a singer, that's a very scary and highly impactful of your career procedure. And he trusted our team, and he did wonderfully. And I just love that we get to hear him sing with his new lungs now. So this is a song he wrote called Sinkhole Blues. I'm not going to play it, but you're welcome to go see it. This is UCSD's first ever mobile ECMO patient. So UCSD in the last year started a program where they take a heart-lung bypass machine and they'll fly UCSD staff out to hospitals, put patients on heart and lung bypass, which is basically, it's a machine that will make them have a heart and a lung. It oxygenates and pumps blood at the same time. And these are really sick patients who are otherwise, very close to the brink of death in an ICU somewhere, a limited resource hospital that maybe doesn't have these access to this type of machine and high level of care. So our team will go out, they'll put the patient on this bypass machine, which if you ever know someone that's had heart surgery, it's the same type of machine used in heart surgery. And they'll put them on the machine, transport them back to UCSD, and if appropriate, we'll work them up for transplant. So this is a very young woman, 38-year-old. She had a genetic heart condition, and she was brought over by our ECMO team on December 16th, and she was transplanted less than a month later on January 12th and went home 15 days later. So a really great success story of how UCSD is trying to really help patients even that aren't at our hospitals. The next thing I want to touch on is living donations. So I know Kirsten mentioned it. Thanks, Kirsten. Other ways to receive an organ transplant. So as Kirsten shared with us, the organ numbers are limited. There's patients that die on the wait list every year. So we're very invested in trying to develop alternatives to that. And that living donation is a great option. So we have a pretty steady living donor kidney transplant program. Over the last 5 years, have done around 50 transplants a year. And that's a really great option. Waiting on a kidney wait list, you're going to wait in California probably 10 years to get a kidney. So that's 10 years of dialysis, 10 years you can get sicker, 10 years your kidneys can affect your other organs. And it's not a good quality of life. These patients usually can't work because of their dialysis schedule. So a lot of patients are able to find kidney donors or family, friends, or strangers and get transplanted that way. We also have a living donor liver program, which we had not had opened for a while until 2021, the end of the year. We did 2 living donor livers, and then calendar year last year we did 3, and we're on track to do a couple more this year. It's a bit more complicated than kidney living donation. The patient has to be correct in that they can accept a portion of a liver versus a whole liver. And then the recipients also have to be very healthy to donate a portion of the liver. But this has been a great option for patients that works for, and it's been very successful. So here's a living donor liver story I wanted to share with you. This is Andy and Mike. Andy needed a liver, and he was a patient where a living donor would be a possibility. So he worked with our living donor team and was trying to find a match. He had, circulated it through his friends, his family, his work, everyone that kind of, lived near the area, and he wasn't able to find a match. His brother lived in England, and he was like, you know what? I'm on a different continent, but I'm going to come over and we're going to see if I'm a match. And he came and he was a match. And so they took part in a living liver donor transplant. And you can see them there. I'm living with a liver transplant and rocking it. And the other one, of course, I'm an organ donor. Who wouldn't want a piece of this? They're great guys. You can see them ringing the bell together. This bell is on our 4th floor in the Jacobs Tower. And it's a bell that patients get to ring after they receive a transplant. So as they're discharged, patients go by and ring the bell. And these gentlemen got to ring it together. And then there was a a Today story from UCSD if you wanted to read more about their story. And here's another example of a patient who also was able to find a living donor kidney match. This is Devin. She was a pretty popular web developer, graphics, 3D animation teacher online. And she was able to find a kidney donor through her network online, and she launched an online campaign and found a kidney donor that way. She was transplanted in January 2022. I'm not going to go too much into the statistics here, but I just want to share with you a little bit about our programs. It's always fun to brag about us. Our heart transplant program is number 2 nationally across all programs of the same size. So we are number 2 for patient survival at 1 year. Our lung transplant program, is also number 2 nationally for programs of a similar size in 1 year survival. Our liver program is number 10 nationally, and there's a lot more liver programs than there are heart and lung programs. So we're very happy with being number 10. And that's also for 1 year survival. And then our kidney program is number 7 in the nation, which is a huge accomplishment. There's lots and lots of kidney transplant programs, and we're very proud to be number 7 for 1 year survival. So that is all the slides I brought for you today. I'm going to stop sharing. And then we can be open for questions for either me or Kirsten. And I saw some in the chat, so let me just peek here really quick. Sally, hi, my brother's been on the kidney transplant list in another state for 2 years. Where can a family obtain info on how to start a donor chain and find him a match? You should be able to reach out to the transplant center where he's listed, and you can ask them if they have a living donor program. If they don't, then you're welcome to contact us. Our phone number is on our website, or I can message it to you, our main number. And if you want to ask us about living donor kidney transplant, it's possible we could list him here too, depending on his situation. So that would be probably the best place to start, Sally. But if you want, you're welcome to email me as well. I'm going to put our main phone number in the chat here, and you would just call and ask to speak to our kidney transplant living donor coordinators, and they can help you if his center can't. Okay. Any other questions?
Yes. Can you be on multiple donor lists, for transplant with multiple teams, even out of state, or just in, so people have to apply to each transplant center? And is that really feasible, for all the eligibility issues? And I have a relative with needing a kidney transplant, so I'm trying to figure out the best way to be a resource for him.
Yeah, great question. So yes, UNOS allows you to be, it's called multiple listings. So any patient can apply for multiple listings. It's a rule that it actually has to be an option for everyone. And so every transplant center is different on the criteria that they'll accept. Some centers are more aggressive and will accept patients with, let's say, like multiple medical issues. One thing UCSD does a lot of is congenital heart defects in the heart and lung, and even some abdominal patients have congenital issues that impact and cause a need for transplant. So many centers won't accept those patients. So depending on him, if he's already listed somewhere, I know we would be happy to look at him and kind of, it all kind of starts with insurance. Unfortunately, we try to accept as many insurances as we possibly can here at UCSD. But the best thing to do is call centers that he might be interested in. Typically, for most organs, you're required to live within a certain closeness to the center. So meaning when Kirsten is working up a donor and she starts making the phone calls that we have a kidney available, your brother, correct?
Brother-in-law.
Brother-in-law, your brother-in-law would need to be able to get to that center quickly. So it really depends on a patient's ability to travel, and like proximity to the center. So I know like on the East Coast, a lot of centers are close together. Like, there's like New York, and then there's like a bunch of centers nearby there. So a lot of patients are dual listed because they, it's 3 hours to New York and then it's 3 hours down south, and they can do both areas. If
I think
if the
age
patient has
may be
means
a
to
fact. I
fly.
think he's 74, so I think age may be excluding him from he lives in the Bay Area, maybe excluding him from some of the centers there, UCSF
Yeah.
or Stanford or Sacramento.
Some of them may have age cutoffs, and I'm not an expert on our kidney program here and if there's any age cutoffs, but I'm happy to ask and get
Okay.
back to you if you'd
Okay.
like. But I only see MLCP, so you'll have to let me know who to contact.
Oh,
I can ask
I
Betty
can
too.
call that. I can call that number too. And
Yeah,
and you are.
I'm the lung transplant manager.
Oh, okay, okay. But I mean, you're Kirsten. I can't tell who's speaking right now.
Amanda Cole.
Amanda. Okay, thank you, Amanda. Okay.
Of course. All right.
Well, I guess I'll raise one more issue. So one of the options that he's been presented with, that because of his age and the length of time, you said 10 years for a kidney in California, is that I guess hepatitis C is possibly now being considered a possible donating organ, and that, that obviously there's complications that could come with that, but they felt medications now may be good enough that recipients of donors with hepatitis C could have maybe better survival than if they waited and then aged out, I guess, of the eligibility for a transplant. So I didn't know if you had any comment about that, because I was certainly not aware of diseases, being allowed. Yeah, before. I thought everybody had to be super healthy. So
no, that's a great question. And I used to be an organ coordinator like Kirsten about 5 years ago. And when I started that job, we were not transplanting hepatitis C organs. And then they came out with a medication that's actually curative for hepatitis C. So now you can, let's just say you're a regular person with hepatitis C, you can take the medicine and be cured of it. So it makes sense that if a patient had hepatitis C, they were a donor, let's say they donated a kidney into someone without hepatitis C, there is a risk of transmission there, right? It's a blood-borne disease.
sure.
So there's a chance that you could also contract hepatitis C as the recipient. There's also a chance that you couldn't. But with immunosuppression, we guess that you're probably going to at least have an exposure to it. So then we put the recipient on the treatment course for hepatitis C. It's I think it's like an 8 or 12 week medication regimen.
Okay.
And then they're cured of hepatitis C. So there is like a little bit of period of time where you are exposed to it and treated for it, but it's very safe. It's working very well. We're doing it in all of our organs here.
Okay.
And it's a great option to speed you up on the list.
Thank you.
Of course. And so, like Kirsten said, I know she stopped when we asked about the rule out question, because the rule outs change every day, for organ donors, and because the medicine advances so quickly of what we're able to transplant. So another example is that we can actually donate HIV positive organs into HIV positive recipients. So that's a really incredible use of an organ that we could have never donated before. And that's also in the last 5 years.
And with these donated organs, what do recipients, can they expect survival? I mean, if they don't reject these organs, is there data that indicates the longevity of their organ, or is there limitations? I imagine they have to take immunosuppressants for how long? I don't know all this. Yeah.
Yeah. So everyone who receives a solid organ transplant has to be on immunosuppression medication for the rest of their lives. So that's a daily medication they'll need to take to prevent their body from treating their organ like an infection and fighting it off. And so, the meds start out at a higher dose and they get tapered down in time. And it's a constant measuring to make sure that the organ stays healthy. And patients that are post-transplant, although they have a new life, they definitely still have appointments they go to and they get checkups just like any other patient to make sure the organ's healthy and we can have them on the right medications. Longevity of a transplant, it really depends on the organ. It tends to vary the most organ to organ. Lung transplant historically has the lowest longevity of survival, but that's not to say that we have a patient who's like 25 years with a lung transplant here. So that's an incredibly long time.
Excellent.
If you'd asked, 5 or 10 years ago, it was very unexpected for a patient to survive less than 3 years with lungs. But the medications get better every day, and the anti-rejection medications get better. So people are living much longer lives now with transplant than they were even a decade ago. We have many heart patients, kidney patients that are 20 years plus. So that's pretty frequent, but it really depends on, one of the things we try to do is really utilize the gift properly. And that's part of the workup here, is that we want to be sure that, you can afford your medications. And if you can't, then we're going to get you on a plan so that we can help you afford them. And we want to be sure you're going to, treat your body with respect and not, do things that could impact your organs. And we want to be sure that your blood pressure is normal. Even if you didn't get a heart transplant, blood pressure matters for kidneys too. So we do all those things to make sure people are going to be medically compliant as we can, to really honor the gift that they're given, because it is in such short supply. So I think, patients that are the most compliant tend to also do well. For transplant, what ends up either happening to end the person's life is typically either rejection, in most cases, like a chronic rejection of just over a long period of time. The body eventually catches up and tries to fight against the organ despite medications. And then the other thing we see a lot of is infectious disease or cancers. Because of the immunosuppression medication, patients are a lot more prone to catching infections, especially minor infections can really impact a transplant patient. And then cancers tend to move more quickly because they're on immunosuppressants.
Good point. Thank you.
Of course. Any other questions? I think I was working with Betty to kind of set up this agenda today. Anything else, Betty, you want us to cover? I saw Joan raise hand. I think you're on mute, Joan.
Mute. There we go. It was down far. Are you also going to talk about stem cell transplants?
We don't do stem cell transplant as part of the solid organ transplant program. I think that's a primarily research backed endeavor at this point, but there is a lot of research right now into like growing stem cells into organs. You may have seen in the news last year, there was the first xenotransplant. They took a pig heart and transplanted it, and the patient survived for quite a long time. So I think, when there's scarcity, then people innovate. And as we know, there's scarcity with organs. So I think, every day people are researching how to improve that and improve access. Was there something specific for stem cells you were thinking, Joan?
No, I was just, I've had 2 myself and doing quite well. And I was just wanted to celebrate all the work that's being done at Jacobs.
That's great. Congratulations.
Thank you. I thank Dr. Ball every time I see him. It's a separate question. I'm being treated for multiple myeloma. Can I still donate organs and tissue, or is that in the cancer field and cannot be included?
Yeah, so that's a hard question. I'm not sure. Typically, I would probably say no. However, we would still do a thorough look into your past medical history. How long have you had it? How is it being treated? if you're cured of it, how long have you been cured for it? A lot of times, if you have cancer and you've been cancer-free for over 5 years, then we're able to re-review and become eligible for organ donation. So it really just depends in timing and treatment and if it's active.
So I should stay on the donor list and then somebody will decide yes or no.
Absolutely. I would always recommend stay on that list, stay registered. We will do if it gets to that point where you're being reviewed for organ donation, we will do a thorough review and we'll be able to make a safe decision. And again, like with Amanda, we work very closely with the recipient side and we make that decision together if we're able to transplant any of your organs if it comes to
Great.
that.
Thank you.
Okay, so Amanda, this is Betty, and one of the, because I'm a volunteer on a couple of committees, and during the safety committee, I heard that because our blood bank was managed so well that during COVID, we were able to donate or transplant more organs than some of the other UC systems. So apparently that's really a significant part of the transplant program.
We interface very closely with blood bank, and Kirsten actually as well interfaces very closely with our HLA lab, which is blood typing and specific tissue typing that is very important related to transplant. UCSD did have a much better blood supply situation than many hospitals during COVID. And Kirsten also, they utilize blood for donors sometimes. Transplants in general, especially liver, heart, sometimes lung, they do utilize product in the OR during those cases. So if there is not adequate supply in the blood bank, then we would have the potential to have to cancel cases, but our blood bank is managed very well and we've never had to cancel a case for a blood shortage.
Okay, well, thank you. I along with everyone else, I appreciate you being able to do this for us today. Thank you.
Yeah, this was a great opportunity to meet you all. And if you need anything, again, our main phone number there for our call center is in the chat. Betty, do you want to send out slides or emails, or is there anything else we can help you with?
Well, Vanya would be the person that would, because we repeat these so that these programs can then be watched through our YouTube program. So it's not just the people who are here today, it gets much more widely reviewed. So Vanya, do you have any?
Yes, you can just send those slides over, or the recording would be sufficient as well. If you have slides easily able to send over, I can share that with all of the members. But yes, Betty is right. We'll have a lot more views on this video. It's such an important topic, and thank you so much for sharing this information. I'm gonna go add myself to that donor registry list right after.
Thanks, Vanya. Well, Kirsten and I will send over our slide decks. I believe our contact info is also on this slide. So if you need anything, don't hesitate to reach out to either of us. Thanks again for the opportunity.
Thank you, guys.
Bye-bye. Thank you.
Thank you.